Hi, my name is Dr. Yow Kuan Heng. I'm a consultant vascular and endovascular surgeon. As a vascular endovascular surgeon, I treat diseases of the arteries and veins through open surgical methods and also keyhole or endovascular methods. One of my pet areas is looking after and treating patients with abdominal aortic aneurysms. An aneurysm is a localized swelling or dilatation of the aorta, which is the biggest blood vessel or artery in the body. It's usually about 1.5 times that of the neighboring blood vessel, and when it gets to a certain size, it is at high risk of rupturing. Malaysia has a certain reasonably high incidence of abdominal aortic aneurysms. It's about 2% of the population, which roughly makes out it to be about 360,000 people have that disease in the population at any one time. The disease of aortic aneurysms is often known as a silent killer. There are often no signs and symptoms. It remains asymptomatic until it ruptures. Most of us, unless we are very, very thin, will never notice it. Sometimes if we are slim, it will be a pulsatile lump in your tummy. The signs of rupture: severe abdominal pain or back pain, and the feeling that you are about to faint or collapse. Established way of treating abdominal aortic aneurysm is an open repair. You make an incision in the patient's abdomen and you then stitch a polyester graft to exclude the aneurysm from the rest of circulation. The modern way would be minimally invasive, 2 small groin punctures, and it's called endovascular aneurysm repair, where we parachute a graft into the aneurysm and then it excludes it from the circulation. Like I said, minimally invasive and has a very low mortality rate to it. As I mentioned, it's important to remember 5 things with aortic aneurysms. Number 1, it's a silent condition. Most of us don't know about it until it ruptures. Number 2, we have very effective ways of treating aortic aneurysms. One is through open repair, the other one is through keyhole. Number 3, we have a very effective way of screening for aortic aneurysms, which is a screening ultrasound. It's cheap, it's effective, and it's easy to do. And number 4, it's important to screen for it because the mortality rate for a ruptured aneurysm is about 80% compared to about 2% mortality rate for a planned or elective repair. And lastly, we have a lot of good hospitals now that are offering aneurysm screening packages. For example, in Bukit Tinggi Medical Center, you get to see a consultant surgeon, but also have a scan done of your aortic aneurysm and possibly look for aneurysms in your legs as well.